Hey guys, it's Louis here from ndxtesting.com, and in today's video we're going to speak about what happens during an EMG. Now I have taken a lot of videos regarding this topic, but I think today is going to be the most precise one because I'm going to show you the actual instruments we use in order to do the EMG and nerve conduction study examination. So if you're going to have an EMG, if you're a patient and you feel a little bit nervous as far as what happens, just relax yourself a little bit because after this explanation, you're going to feel much more comfortable, and at least you know exactly what's going to happen when you go into the medical facility. So with that being said, let's get started. Now, the first question you need to know is, or the first answer you need to know is, what is an EMG? Now, the two key words that you need to remember is this. What's an EMG? It's a nerve and muscle examination. That's all you need to remember. Now, those are the structures that we're going to examine. We're not going to get any information as far as anything else. An EMG is a nerve and muscle study. Now, the nerve examination, what happens during that study, we use electrical impulses. That's all we do. Okay? We use electrical impulses on the extremities, meaning arms or legs. So the technician is going to do the nerve study. He's going to use electrical impulses to stimulate nerves at the level of the wrist, at the level of the elbow. If you need the lower extremities, then he's going to stimulate at the level of the ankle and at the level of the knee. That's all you need to remember for now. Now, the EMG, which is the electromyography study, now what happens now, they're going to use the medical doctor, either the neurologist or the physiatrist. Those are the two main doctors who specialize in EMG. They're going to use a needle electrode. And they don't use any electrical impulses during that study. Okay, sometimes patients get a little worried, oh, a needle, I'm going to feel electricity, or electricity, I'm going to feel a needle. No, during the nerve examination, all you feel is electrical impulses. And during the needle examination, all you feel is a pinch. It pinches the muscle and it records the muscle activity. Now, one of the things that I want you to, that you should know, just for your own personal education, note that all the nerves you have from your shoulders to your fingertips originates from the neck. Okay, so the neck is like the fuse box of the upper extremity. So when the technologist is doing the nerve examination, when he's examining the nerves in the arms, he's getting a lot of information that comes from the neck because all the nerves originate from there. Now, the way your brain communicates with your arms is through your neck. If the neck goes, then you won't be able to move your arms, or at least the brain won't be able to communicate with your arms. Likewise, too, all the nerves you have from your hips to your toes originates from the lower back. Okay, so then the way your brain communicates with your legs or with the extremities is through your lower back. If your lower back goes, then you won't be able to move your legs. And that's in severe situation. We're not talking about exactly what's going to happen in this situation, but in severe situation, so you can understand as far as the anatomy structure of these studies. Now, a lot of questions is, you probably feel a little nervous. I get a lot of patients that come in nervous because they think the test is going to hurt. Or maybe they had this test someplace else and it was a nightmare for them. It was painful and they come in nervous. So my job as a technologist is to make these patients feel as comfortable as possible. Now, do the tests hurt? No. If it's done properly, okay, you shouldn't be a problem. Now, the nerve examination, okay, and I emphasize this in all of my videos. Now, the nerve examination, when we start the nerve study, or at least when I start the nerve study, let's just say I'm going to start with the upper extremities. No matter where you go in the world, if you're going to have a test and it's going to be done on the upper extremities, the technician, it could be a technician, male or female, it doesn't matter who it is. It could be a doctor. A lot of doctors perform the nerve studies. They're going to start at the level of the wrist. Now, what happens is, when you start at the level of the wrist, I like to communicate with my patient, relax yourself, nothing's going to happen. And we're going to start with the intensity not low, but at 0. And I communicate that to the patient. Do you feel it? No. Okay. At that point, I just increase the intensity slightly. All I want to know is, I want to know when they feel it. Once they respond to me and they do feel it, okay, this is basically what's going to happen. So you increase the intensity. All you're going to do past that, or at least what I do past that, is I use the exact amount of intensity that patient needs or that nerve needs in order for the nerves to depolarize, for the nerves to react. Now, it only hurts when the technician doesn't use this, just doesn't do the test this way, and they use too much intensity, or perhaps maybe they start high. If you start high, Now, there are patients who are electrically sensitive, so it's going to irritate the patient. So you want to be able to start at 0, increase a little bit until they feel it, and then all you do is use the exact amount of intensity that patient needs for the nerves to react. If you use that technique, then you should be fine. I've been doing this for 25 years, and in my experience, nerve examinations do not hurt. But obviously, if you use too much intensity, then it's going to hurt. Now, I'm going to show you guys here what we use. Okay, I haven't done a video showing you guys this, but this will be the first video. I actually brought this from work. So this here, if you see it good, okay, this is a stimulator. This is what we use to do the nerve examination, okay? So basically I hold the patient, I stimulate all over the place where, as far as I need to, stimulate at the wrist, okay? Stimulate at the elbow. So when you stimulate, let me do it with your right hand better. You stimulate at the wrist, so when I start at 0, I increase, do you feel it? You feel a little bit, and then I increase until there's a response, okay? So when you do the nerve, at least the first nerve, which is called the median nerve, right, there's going to be a thumb response, okay? And then you come here above the elbow a little bit, you stimulate. What I like to do, I like to kind of decrease a little bit, and then increase slightly until there's a motor reflex. What happens when you stimulate? There's a motor reflex, okay? So when we do nerve studies, there's 2 types of nerves that the technician or the doctor examines: motor nerves and sensory nerves. Now, motor nerves are attached to muscles. That means that every single muscle you have in your body, you have a nerve attached to it. So obviously, if you take care of your muscles, your nerves are going to be okay. You also have sensory nerves. Sensory nerves are attached to the skin. So when you touch something hot, you have sensory receptors in your hands or in your skin that automatically, even before the brain knows it, you remove that hand. So those are the nerves that we are attached. Motor nerves, they require a little bit, perhaps a little bit of more intensity. Well, depending on your body structure, there's going to be a reflex. Sensory nerves, they don't need much of a reflex. They need less intensity. So sometimes when I do see patients, they're a little bit on the sensitive side, then I kind of modify the protocol a little bit, and I start with the sensory nerves, which require less intensity. But either way, I do the exam according to the patient's body structure. So let's just say you're a male, and like myself, I'm 5'9", 175 pounds. I mean, that's between 172, 175. Sometimes I fluctuate 3-4 pounds. I'm not, I don't have any medical conditions. Okay, I don't have any diabetes, well, at least not yet. I got, trying to take care of myself. I'm not going to need much intensity. So when the technician starts, if I have this exam, which I've had it many times, I don't need much electrical impulses to get my nerves excited. Now, obviously, if I go to the wrong place and they have a bad technique, they can use a lot of intensity on me, and even on myself, it can hurt. But if you use the correct amount, then you're going to be fine. So this is what they use. I don't want to complicate this video too much. I have a lot of information as far as what happens during an EMG. And I have another video that I do a nerve study, and I take you to the precise settings as far as what I need in order for my nerves to react. You're going to see me do a nerve examination, at least a sample nerve study, on myself. That way, when you get this nerve study someplace else, you already know exactly, what's going to happen. So it doesn't hurt if the technician uses the exact amount of intensity. Then you're going to be fine. Now, with the lower extremities, they start at the level of the ankle. Okay, it should be the same procedure. Start off low, start off 0. You increase until the patient feels it, and then you increase until there's a motor reflex. If you do that, it's going to be okay. And obviously, I think I went off the topic. Like I said, I'm 5'9", 175 pounds. I don't have any medical conditions, so I'm not going to need much intensity. If let's just say I was sick, I had some medical conditions, maybe diabetes, maybe some arthritis, and I'm 300 pounds, then I'm going to need more intensity. I have more tissue. The more tissue you have, then the more intensity you're going to need. Now, that's it for the nerve examination. Like I said, I have a lot of more videos on that. I have about 10 videos, or 9 videos. This will be the 10th video on the performance of EMGs and nerve conduction. So, and then remember, the nerve study, when we do it, again, there's no needle involved. Now, this is what we use for a, this is the needle electrode, okay? I'm gonna take it out. I want you guys to see it. I'm not going to pinch myself. Maybe I'll pinch myself a little bit, we'll see. All right, once the nerve examination is performed, a doctor, a neurologist, a physiatrist, and hopefully the doctor that I work with, she is the best in the business. If she wasn't, I would not be working with her, that I can honestly tell you. But she's definitely really good. She has good hands. And when you do an EMG, okay, when you do a needle study, you need to have good hands. Now remember, so the needle electrode that we use for EMGs, it's not designed to withdraw blood. It's not designed to insert any sort of medication, okay? All we're going to do is we're going to take out the needle. I want you to see it here really quick. Look, let me stretch out. See it? Can you see it there? Okay, I'm going to take it out. All right, you see it? Small little needle. Okay, hopefully you can see it. Okay, so the doctor, all right, small needle, takes out the needle and pinches the muscle. Okay. Usually when I used to teach doctors how to do it, what I would like to do is kind of just grab the skin a little bit, okay, and pinch, like acupuncture. So if you can pinch yourself, right, really hard, that's basically what it's going to look like. Once the needle's in, then what the doctor does, he studies the muscle activity of that muscle. Okay, you don't feel any electrical impulses. Now, obviously, depending on your clinical diagnosis, this needle usually goes on the traps muscle. Okay, it can go on the deltoid muscle, it can go on the bicep muscle, it can go on the tricep muscle, and some muscles on the arm. And I gotta be honest with you, it does sting a little bit when they do the muscles of the hand. So let's just say you have carpal tunnel, and the nerve examination says you have carpal tunnel. And when you have carpal tunnel, that means, what is carpal tunnel? Carpal tunnel is median nerve compression at the wrist. Let me put this needle back. So the last thing I want to do is kind of pinch myself a little bit. Okay, so now remember, the needle part, once the doctor's doing a needle examination, you don't feel any electrical impulses. I mean, some patients like this part first, some patients like the electrical part first. Either way, you know, when I do the exam, I make sure that the patient has a good experience, and some of them like it. And then the doctor that I work with, then she's pretty good at what she does. Okay, I'll save it here for a little bit. Maybe we'll use this again. So the tests, if they're done properly, they're not going to hurt. You already see what we use. We use a stimulator, and it stimulates the nerves, and then we use the needle electrode, like I was saying before. So depending on your clinical diagnosis, okay, that could either be done on the neck, okay, shoulders, arms, hands. Like I said before, it stings. Oh, I almost missed my point here. So when you do nerve studies, right? If you have carpal tunnel, that means the nerve at the wrist is compromised, okay? And you have tingling and numbness, and the nerve examination shows that the nerve, it's affected. The test of choice is the nerve examination. So the doctor, since it's sensitive to do these muscles here in the hand, it's sensitive. When we used to practice, I used to pinch myself, and that's the only part that I didn't. I'd rather have it on the neck, but not here. And I didn't like the way it felt there. But when you have carpal tunnel, it's not really necessary to do it there. Maybe a little bit, but the test of choice is it's a nerve examination. So you can just get away with having the nerve study done. And then obviously the doctor, if I'm the physician performing the study. By the way, I'm not a physician, I'm a technologist. My specialty is the peripheral nervous system, nerves and muscles. I specialize in nerve examinations, and I also teach doctors the EMGs. And but I can't, by law, perform an EMG or stick a needle into a patient. You know, I can't do that. I mean, I know how to do it. I do teach it. I show doctors. I make sure that the doctors that I work with, you know, they do good work. But I can't stick a needle into a patient. I got Google there, messing things up. Anyway, so and then obviously if you have the carpal tunnel, I think what I would do as a doctor, I wouldn't pinch the muscles there because it's not really necessary. But I would make sure that at least things on the neck are okay. Because if you have a pinched nerve in the neck, that would be called a radiculopathy, and let's just say you have carpal tunnel, that's called double crush syndrome. So I would make sure that everything's okay there at the neck. And if you do, then I will know. But I don't think that I'll have to stick needles into the muscles there. But every doctor is different. Another thing you could do, if in a lot of labs too that are very experienced, is what they do. Sometimes for carpal tunnel, they can instead of sticking a needle in there, a ridiculous needle to these muscles, they could do ultrasound. Okay, they use diagnostic ultrasound, and they can examine the nerve, and they can get further proof of the carpal tunnel. So you got the nerve study, okay, which is pretty cool, using the electrical impulses. Then you have the ultrasound, which you can take the measurement of the nerve and then find out further proof of that. But I'm not telling these doctors, and I'm not telling you, the doctors what to do. I'm just giving you a lot of information as a patient. So there you go. I think this is the last video that I'm going to take out. Now this is a brand new channel. This is a medical channel. We're not just talking about EMGs. We're starting with electrodiagnostic medicine because that is my specialty. I've seen a need when it comes to the study and for patients, and I want to give you patients the power to have a complete visual understanding. So when you go into the medical facility, you know exactly what's going to happen. So I have a lot of videos during this topic. I also have a video where I do a nerve examination on myself. If you can't, I'm going to link it into the description. But if not, then you can go into the channel and you can see. It says, what happens during a nerve conduction study, or at least what you feel during the nerve examination. I definitely encourage you to see that video. That's actually a good one. But like I said before, this is the purpose of this channel, is to give you diagnostic healthcare information. It's not just about talking about EMGs. We're going to be speaking about health. We're going to be speaking about how to take care of your body, how to take care of your health. We're going to be speaking about one of the main root causes of anxiety now. And I just took out this video, at least part one. One of the main causes of anxiety now, we have about 40 million people in America that have anxiety. In at least 10 million cases, it gets undiagnosed because of a root cause. Now, no matter what happens to us, there has to be an explanation. Now, with anxiety, of course, if we know where it's coming from, and we have occasional anxiety, and let's just say you're a young person, you're going to take a test, or maybe you're an older person, you lose your job, now you're worrying about how to take care of your family. Now, that's occasional anxiety. We're not going to speak about that. We're going to speak about when a patient has anxiety and they don't know where it's coming from. So there's a root cause out there, and we're going to discuss that in this channel. So we're going to give you diagnostic, good healthcare information so you can take care of yourself, take care of your health, because the truth of the matter is, it doesn't matter if you're a millionaire, a billionaire, or you can have the best position in life, but if you're not healthy, if you're sick, then that's a problem. So we're going to teach you, we're going to give you the latest preventive measures, because you want to use preventive measures in order to be able to take care of yourself. You don't want to wait until you're sick, okay? You want to take care of yourself now. And I've been taking care of myself for a very long time. I'm 52 years old, and hopefully I'm working hard so at least when I'm 60, I look good and look healthy, because you want to look good, and you want to be healthy, and you want to be able to take care of yourself. You want to be able to take care of your family. There's so much information out there. There's so much medical tools that we didn't have 10 years ago, 20 years ago. And the purpose of this channel is to bring this to you so you can stay healthy, because the truth of the matter is, sometimes you go to your doctors, they're not going to tell you. They're going to give you a quick consult, you're going to do what you got to do, and you're done. But in this channel, if you spend 15, 20 minutes, then you're going to be able to receive this diagnostic information. And EMGs, nerve conduction, let's just say, it's good because it's also preventive measures. Now, the peripheral nervous system, okay, which is a superhighway of the body. Actually, you have two major superhighways of the body. You have the peripheral nervous system, which is nerves and muscles, and you have the cardiovascular system, which is arteries and veins. Those two you need to take care And we're going to take our videos. We're going to show you how you take care of both your peripheral nervous system and your cardiovascular system. So if you found this video helpful, please share it with friends, and definitely appreciate that. Or definitely appreciate YouTube as far as exposing my video out there, so more people can see it. So please share it, and please subscribe to the channel. If you find this channel helpful, please press a like. It will help me too on YouTube. And like I said, if you find the video helpful, then share it. And I'll see you in the next video. Okay, bye bye. Thanks.